I am Elizabeth Zwilling, and I am an assistant professor of nursing at Miami University in Ohio. Well, when I came to the university back in the fall of 2021, we were kind of in a place where, COVID had just happened. There was a lot of disruption in what the clinical placements were, and simulation had been recently added to the mental health course. We came up with an idea to collaborate with the theater department, and from that collaboration, we developed a course called Acting for Medical Simulation. And so when we were training these undergrad students, some were theater majors, some were not, and we were talking about heavy topics in mental health, I was wondering how their experience was as the simulated participant. And that's what started the idea of doing a survey, getting their feedback about what it felt like, why they took the class, and what it felt like to play the patient in a nursing simulation. The one interesting point was that there was a great interest in this course from our pre-med track. So these are not students that had had any acting experience. And so their reasons for taking the course were, well, what would it feel like to be a patient, right? So they were coming at it from a different perspective, where the theater students somewhat had an experience of like, oh, this is a skill that I could use. So there were those two different perspectives. So there were only 13 students that were in this course, but one of the things that came out of it was that it did affect their personal mental health. And one student disclosed, they did not disclose this during the course, that after they were the simulated participant for the eating disorder sim, that they did have some restrictive eating behaviors. And that was, pretty shocking to me as a researcher. And what we took away from that was really an emphasis on how to lower the student's psychological risks. The difference is that we minimize, I think, some of that psychological risk by doing a survey at the beginning to ask if they feel unsafe about any of the certain topics. I made the decision to not train students on the eating disorder case. Instead, we focus on the substance use and the psychosis. And for the students who take that class, we thought of safety, like what would happen if a student felt unsafe in the middle of the simulation, and we have a process for that. But I think we strengthened it because of these findings, where they receive an email, we have the crisis line we put them in contact with. We encourage them to reach out if they're having issues. We also put more emphasis on de-rolling. So what they're doing to step out of role, so they step into role to play the simulated participant, and then what are the things they're going to do when they step out of role? So I think that's one of the big things that I think we need to think about moving forward. I think for any person who's playing a simulated participant, we have to think that this does have an impact, and we have to worry about, making sure that they're okay too, and minimizing the amount of times maybe they portray a case that has a heavy psychological risk to it. I feel like I'm just at the beginning. This is my first research that's been published about simulated participant work that I'm involved in. I think it's an area that is not been well researched, especially I think we know I think it's well known that simulation and simulated participant simulation is highly effective to healthcare students, right? That the healthcare students learn a lot, and I think that's been proven. But what is the standardized patient or the simulated participant's perspective? I think that's an area that is important. I'm currently doing some research about verbal feedback. And the takeaway from a simulated participant was giving verbal feedback to nursing students, and the lessons and the themes that were learned from that. One thing that came out of from this study was that there were students who said that it made me think about what kind of provider I wanted to be. And so I think something I'm interested in would be a long-term study of like, what was that impact? Can I follow those students as they leave their undergrad and go into medical school? Because that experience of being the patient, I think would be great. I think it would also be great for our nursing students to learn how it is to portray a patient and feel that experience would give them greater empathy for their patients.